Continuing here, quinolizidine alkaloids. So here we have N and a heterocyclic ring. Okay, and N is connected to at least 2 carbons. You can see it here. Okay, it is coming from lysine. Now it is making others. So they are biological activities: cytotoxic and anti-cancer activity, anti-inflammation action, inhibition of plant growth, insecticidal activity, antibacterial, antifungal activities, antiviral, antimalarial activities, nervous system activities, cardiovascular activities, immune system activities. Attempt to define alkaloid originated at the time of discovery of these compounds. Frederick Schreiner, an apothecary's assistant, was first isolated morphine, and it is one most important alkaloids. Morphine is an alkaloid. Okay, opioid, alkaloid, morphine. In 1805, the method of isolation was significant step in chemistry and pharmacology. Using the method by range of the alkaloids such as buricine, fibrinogen, quinine, caffeine, and vitamin. The term alkaloid was first mentioned in 1819 by him, apothecary from Hill. He observed that the chemicals are like alkali and so named it. Why are they like alkali? I don't know. In the medicinal science, term alkaloid means any group of nitrogenous substances of vegetable origin, often of complex structure and higher molecular mass. Alkaloids are often heterocycles, have primary, secondary, and tertiary bases, or may contain quaternary ammonium groups. Alkaloids are partially soluble in water, soluble in ethanol, benzene, ether, and chloroforms. Alkaloids are potent in creating intense physiological action, and they are widely used in medical fields such as curative drugs. Some alkaloids can also be highly toxic, even in very small doses. The alkaloids of the nitrogenous group organic compound that the pharmacological effects on the humans and from the word alkaloid. Humankind also produced alkaloids, for example, I-dopa, adrenaline, serotonin. These alkaloids are formed from amino acids through various oxidation and decarboxylation process. Occasionally, these are referred to as protoalkaloids or biogenic amines. The medicinal use of plants in the papyri of ancient times in Egypt about 4,000 years ago. In these records, there are ready descriptions. These medicinal use of papyri in Asia. In these records, there are description of utilization of alkaloids containing crude drugs such as opium, hyalniger containing hyoscine, containing colchicine. There is a history of utilization of alkaloids without any written records. Traditional practices passed over the millennia. One of these in the use of plants to provide dye stuff or woven cloth. They used to dye stuff for woven cloth. Okay, these are just a product of living cells for other living cells. Wow, kya baat hai. These alkaloids are instrumental in the battle against malaria, leukemia, and cancer, as well as Parkinson's disease. Wow, which would not be possible otherwise. Pharmaceutical drug industries has succeeded in the use of natural plant alkaloids for the development of antimalarial agents, unique chloroquine, anti-cancer agents, Taxol, anti-malarial, anti-cancer, Taxol, vinblastine, vincristine, agents promoting blood circulation in the brain, benzamine. Alkaloids are generally classified generally classified. Just a second. Okay. Are generally classified by their common molecular precursors based on okay, so it is true alkaloids, protoalkaloids, or pseudoalkaloids. I think the pages are up and down. True alkaloids and protoalkaloids are derived from amino acids, not derived from these compounds. Next is phenolics. Wow. Phenolic compounds and their sources: flavonoids, flavonoids, phenolic acids, and non-flavonoids, polyphenols, flavonoids, phenolic acids, non-flavonoid polyphenols. Okay. These compounds are compounds that have one or more hydroxyl groups attached to the aromatic. One or more hydroxyl one or more hydroxyl groups attached to an aromatic ring. Aromatic ring. I don't know. Phenols is a structure upon which the entire group is based. Phenols are in many ways similar to alcohols of aliphatic structure, where the hydroxyl group is attached to the chain of carbon. Hydrogen of the phenolic hydroxyl is liable due to the aromatic ring, which makes phenols weak acids. Classification: these compounds can be classified in number of ways. Harbon and Simmons classified these compounds into groups based on the number of carbons in the molecule. 6 carbon simple phenolics, C6C1 phenolic acids and related compounds, C6C2 acetophenones and phenolic acid, C6C3 cinnamic acid, cinnamal aldehyde, cinnamal alcohol, C15 flavones. Wow. Okay. C15 flavones, C15 it was C6, C3, C6, 6, 6, 12, 13, 14, 15. Okay, 15. All the flavonoids. Okay, C30 is C30 is biflavonoids. C6C1 C6 is benzophenol phenones, xanthones and stevons. C6 C10 C14 quinines. C18 beta-cynins, lignans, dimers, polymers, tannins, oligomers and polymers. Alternative classification is by Swan and Bate Smith. They group the phenols in common and less common categories. Guidon grouped the phenols into 3 families as follows: widely distributed phenol, ubiquitous to all plants and or if importance to specific plant; phenols that are less widely distributed in a limited number of compounds known; phenolic constituents present as polymers. So first, simple phenolics. Widely distributed phenol, ubiquitous to all plants, importance of a specific plant; less widely distributed, so widely distributed, less widely distributed as polymers. Polymers. So simple phenolics. Simple phenolics: phenolic acid and aldehyde, acetobora, cinnamic acid, common biphenyls और ये तो deep breaths, Apurva, deep breaths. Simple phenolics. Simple phenolics are substituted phenols The ortho, meta, and para nomenclature refer to as 1 2 1 3 1 4 substitution pattern. 1 2 1 3 1 4 ortho, meta, para. Alright. With 3 functional groups, the substitution pattern is 1 3 5 1 3 5 when all 3 substituents are identical. Is designated as tri meta tri substitution pattern, whereas 1 2 6 substitution pattern is Vic meta tri Vic tri. Okay, so only odd 1 2 3 4 5 6 only at 3 5 is resorcinol and 1 3 5 is fluoroglucinol. Phenolic acids and aldehydes, hydroxybenzoic acids are characterized by the presence of carboxyl group substituted on a phenol. Hydroxybenzoic acids are characterized by presence of carboxyl group substituted on a phenol. Carboxyl group substituted on a phenol. Okay, so this is phenol and this is the carboxyl group, phenolic acid. So this is the definition of hydroxybenzoic acid. These are hydroxybenzoic acids. Acetophenones and phenyl acetic acid. So phenones are C6C2 compounds that are rarely found in nature. C6C2 rarely found in nature. These are phenones. This was hydroxybenzoic acid. So this is phenol and acetic acid, carboxyl group, I think. Isn't it? Okay. Next is cinnamic acid. These are 6 common cinnamic acids. There are 6 common cinnamic acids. They have C6C3 skeleton. All plants probably contain at least 3 of them. Oh wow, cinnamic acid. There are 6 common cinnamic acids which have a C6C3 skeleton. All plants probably contain at least 3 of them. Cinnamic acid looks like this. This is the benzene, connected, double bond, connected, double bond O and OH. Okay. Now p-coumaric acid, it has OH on cinnamic acid. Caffeic acid, double OH. Furalic acid, OH and OCH3. 5-hydroxyfluoric acid, OH, OCH3. Synapic acid, OCH, what is this? OCH3, O and OCH3. Coumarins also have C6C3 skeleton, but they possess oxygen heterocycle as a part of their C3 units. Okay, these are. There are numerous coumarins, COUMARINS, many of which play a role in disease and pest resistance as well as UV tolerance. Isocoumarins such as bergins have structure similar to coumarins, but the position of oxygen and the carbonyl group in the Oxygen heterocycle is reversed. Isocoumarins also play a role in defense response. This is coumarin. O is here and double bond O is here. And where is the isocoumarin? This is the isocoumarin. I don't know. Because this is the same structure. Nobody loves me, honey. No. Anti-cancer, anti-fungal, no. Okay, they are different because if I'll rotate it, if I have a mirror image of this, if I make a mirror image of this, it will look like this. O is here and here is double bond O and this is here. See? Okay. Next is biflavonoids. Biflavonoids have C30 skeleton. Very nice. They are dimers of flavonones such as epigenin and methylated derivatives and are found in gymnosperms. Few compounds are known. Most familiar is gingetin from ginkgo biloba. Okay. Next is benzophenones, xanthones and stilbenes. Benzophenones and xanthones have C6C1C6 structure, whereas stilbenes have C6C2C6 structure. Xanthones are yellow pigments in flowers. Stilbenes are associated with heartwood of trees. So they give oxidation, inflammation, obesity, cardiovascular, cancer, benzoquinones and anthraquinones and naphthoquinones. Benzoquinones is C2,6 dimethyl benzoquinones and are present in the root exudates or may stimulate parasitic plant and benzoquinones such as benzoquinone, also known as coenzyme Q. Wow. Also have an electrotransfer role of benzoquinone. So what is the face of benzoquinone in between these? Wow. I think benzoquinone and ubiquitinones. 2,6,2,6 methoxy benzoquinone. Okay, this is 2,5,6 tri methoxy one two 1 2 3 3 1 2 3 4. What's this? I don't know. 3 but 1 2 2 die in butene, UB, no, quinone only, quinone, tris, something like that here. So this is coenzyme Q. Next is naphthalene are rare among the naphthalene. Jargon are relatively common, found in walnuts. Juglone. Anthraquinone is most widely distributed. Quinones in higher plants and fungi. There are numerous compounds, and anthraquinone amide occurs in the rhamnoside of the root. I am tired. Okay, this presentation is done. Next is this natural product and drug discovery. There are at least 5 recognized approaches to the investigating the biological components of the natural resources: random screening, selection of specific taxonomic group such as families or genera, a chemotaxonomic approach for restricted classes of secondary metabolites, target collection of species collected by database surveillance, and selecting the ethnomedical approach. So we are doing random screening, then we are selection of specific taxonomic group such as families, then we are checking which family and genera it is from, we are finding out the taxonomic group. Okay, next, a chemotaxonomic approach for restricted classes of secondary metabolites. We are finding out what is the secondary metabolite it is there, so we are doing chemotaxonomic approach for restricted classes of secondary metabolite. Next is target collection of species selected by database and surveillance. We are doing a target collection of species, okay, by database surveillance. And lastly, selection of entomedical approach. Whatever entomedical approach is, we are selecting by that. Selected examples of natural product derived drugs, both naturally occurring rings. Selected examples of natural product derived drugs, both naturally occurring ring substances and synthetically modified compound based on natural products are used for drugs. Many of the examples shown reflect the considerable structural complexity and the compounds introduced in the market to have obtained from organism very wide diversity. Drugs for cardiovascular and metabolic diseases. The powdered leaves of Digitalis purpurea, Tilpushpi, or Haritpatri, Hrudpatri Sanskrit, have been used in Western medicine for more than 200 years, with the major active constituent being the cardiac glycoside digitoxin, which is still used for the treatment of congestive heart failure and arterial fibrillation. A more widely used drug today is digoxin, a constituent of Digitalis lanata, which has rapid action and is more rapidly eliminated from the body than digitoxin. Okay, weird. As hypercholesterolemia is considered to be the major risk factor for the development of coronary artery disease, several semi-synthetic and synthetic compounds modeled on the structure of mevastatin, produced by Penicillium citrinum cultures and commercialized with the name statins. Levostatin is a natural drug of this type, isolated from Penicillium compactin, and other organism. Atorvastatin, fluvastatin, pravastatin, and simvastatin are also used. Cardiovascular agents, angiotensin converting enzyme inhibitor, captopril and enalapril were derived from teprotide, nonapeptide isolated from wheat vipers, Bothrops jararaca. Wow. So captopril is ACE enzyme decreases angiotensin 1, decreases aldosterone, blood pressure. This is the mechanism of action of captopril. Decreases vasodilation, increases bradykinin accumulation. Wow. Bivalirudin is a specific reversible direct thrombin inhibitor that is administered by injection and is used to reduce incidence of blood clotting in patients undergoing coronary angioplasty. So bivalirudin is a specific and reversible thrombin inhibitor, blood inhibitor, that is used by injection and is used to reduce the incidence of blood clotting. Okay, so blood clotting will be decreased in patients undergoing coronary angioplasty. This compound is synthetic 20 amino acid peptide modeled on hirudin, a substance in the saliva of leech. Exenatide, a synthetic version of 39 amino acid peptide produced in the salivary secretion of a lizard native to the southwestern United States and northern Mexico, called Gila monster Heloderma suspectum. This drug is also administered by injection. It enables improved glycemic control in patients with diabetes too. Nervous system drugs. Morphine is the most abundant and important constituent of dried latex of opium poppy and the prototype of opioid analgesics, being selected for mu opioid receptors. Okay, morphine 6-glucuronide M6G is the derivative of morphine with fewer side effects than the parent compound. The pyridine alkaloid epibatide isolated from dendrobatide frog, Epidora tricolor found in activates nicotinic receptors and has analgesic activity 200-fold more potent than that of morphine. The drug potential of epibetadine is limited to the concomitant toxicity but is important lead compound for the development of future new analgesic agents with less addictive liability than the opiate analgesics. A non-opioid analgesic, ziconotide, which is prescribed for the amelioration of chronic pain, has been introduced in the market recently. This drug is the synthetic version of peptide omega conotoxin M7A. The conotoxin class is produced by cone snail, Conus magnus, and these compounds are peptides of 24 to 27 amino acid residues. Ziconotide selectively binds to n-type voltage sensitive neuronal channels, causing a blockage of neurotransmission and a potent analgesic. This is one of the first examples of new natural product drug from a marine source. Delta 9 trans tetrahydrocannabinol THC is the major psychoactive euphorant constituent of marijuana cannabis sativa. The synthetic form of THC was proved approximately 20 years ago to treat nausea and vomiting associated with cancer chemotherapy, and it has been used for a shorter period to treat appetite loss in patients of HIV and AIDS. Recently, an approximately 1:1 mixture of THC and structurally related marijuana constituent cannabidiol has been approved in Canada for alleviation of neuropathic pain and spasticity for patients with multiple sclerosis and administered in low doses in buccal spray. Another important natural product led to compound is tropane alkaloid ester atropine plus minus hyoscyamine from the Atropa belladonna, deadly nightshade, jarka and shafu hindi, and nati belladonna, Canada. Atropine has served a prototype molecule for several anticholinergic and antispasmodic drugs. Tiotropium bromide, a recently introduced anticholinergic compound modeled on atropine, is used for the maintenance treatment of bronchospasm associated with chronic obstructive pulmonary disease. In the category of anti-Alzheimer's disease agents, galantamine, anti-infective. I don't think I want to do this anymore. Like, this is fucking me up. B-lactams antibiotics binds PBP, inhibit cross-linking peptidoglycan. Cell wall deficient bacteria undergo lysis, bactericidal effect. Biapenem is a carbapenem which and is based on. So where is this B-lactam thing coming from? This is nice. I understood this. This compound binds to the bacterial cell membrane, disrupting the membrane potential and blocks synthesis of DNA, RNA and proteins. Okay, that is also understandable. But where is this beta-lactam antibiotics coming word? Okay, a group of beta-lactam antibiotics. Bipenem, tjacin, daptomycin, okay, PTD, whatever. B-lactam antibiotics, they bind to PBP, inhibit cross-linking peptidoglycan. Cell wall deficient bacteria undergoes lysis, bactericidal effect. I don't think I can do this. Immunomodulators. The fungal derived cyclic peptido cyclosporin A was found some years to be an immunosuppressive agent in organ and tissue transplant. Okay, cyclosporin A. Another compound with the same type of use also acted by the inhibition of T cell activation is the macrolide tacrolimus from Streptomyces. Two further natural products derived from immunosuppressant have been introduced recently: mycophenolate sodium Evolol, the active principle of both mycosodium and earlier introduced from mycofluoride penicillium species. This compound is reversible inhibitor of inosine monophosphate dehydrogenase, which is involved. I don't know क्या है ये. So mycophenolate mofetil, although olfactodeco dependent, manageable. Weird. So gut and liver metabolism, RNA synthesis. So mycophenolic acid, MPA. So there is nothing is happening. Exocrotin 7.7% urine, 0.13% something. Inhibition of IMPDA, gluconosine monophosphate, decrease of GTP, triphosphate, RNA DNA synthesis, immunosuppression or anti-cancer. So growth factor are there. Tyrosine kinase receptor, this is tyrosine kinase receptor not opening. Okay, so P13 PBK, P10 is inhibiting this, ATK is here and MOTR is here. This is inhibiting a gene expression, proliferation, cell survival and angiogenesis. Weird, it is so weird. Okay. Management can involve getting a better understanding of mechanism of action. These compounds have been found to block cancer initiation, blocking or to reverse tumor. Next, ADF. So medicine was also produces same changes in healthy human, cures same changes in disease, like cures like Indian government exists. Law of similar in healthy person, the medicine must produce the most similar symptoms of the disease, then only the medicine is capable of curing disease. Principle of homeopathy. Homeo means similar, pathos means suffering, similar, similis currenter, named as homeopathy. Simila, similibus currenter. Homeopathic action. Arsenic album, the poison in crude doses causes the following toxic symptoms. Arsenic album, the poison in ultra diluted homeopathic potency doses causes the same symptoms. Hippocrates was a cure situation leading to the remedies. The principle of opposite acting remedies and stated the same must be cured by the same. Stated there exists a law in the medicine which he called the law of similar. Introduced, he gave the name homeopathy and drug Shinkona has been used to the treatment of malaria. Several took doses and noted the symptoms. His feet and fingers became cold. He became drowsy. His heart became palpitating. random wretchedness. The symptoms lasted few hours, recorded each time he repeated the dose and taken by a healthy person induced the symptoms similar to that of malaria. This disease, the very disease the drug was used to cure, known as law similar in the basis. He conducted this from the experience that effective drugs may produce symptoms in healthy person. People that are similar to the diseases can be expected to treat. Next is the various. What is this? Individualization, principle of similar, principle of similar, principle of minimum dose, law of proving, law of dynamism. What is this? I don't know. Law of vital force. Concept of individualism. It stated that no two individuals in the world are alike and the disease affecting the two individuals cannot be similar. Although a number of individuals may possess the common symptoms, the individual response to the same disease would be different from person to person. The medicines used to cure some disease different individuals are different. Principle of similar stated that the treatment of the disease by a medicine which produces similar symptoms in the healthy individual by introducing something in the body that causes the same symptoms as that of the disease, it activates the body's immune system. The immune system therefore removes whatever is causing. Principle of simplex. This principle states that the use of only single simple medicine at one time, even the patients may have number of complaints, only a single medicine is selected from Matria Medica. As far as possible, combination practices is avoided in homeopathy. Principle of minimum doses. It is stated that the lower the dose of the medication, the greater is its effectiveness. In homeopathy, substances are diluted in a stepwise fashion and shaken vigorously after each dilution succession and banged 10 times against the solid object. This type of dilution is known as potentiation. This process is believed to transfer the spiritual essence to the water it is diluted in. The water is supposed to have a memory. Thus, this theory is also called memory of water. Lower the dose of medication, the greater is its effectiveness. Substances are diluted stepwise fashion and shaken vigorously after each dilution. This type of dilution process, banged 10 times against the solid object. This potentiation is transfer the spiritual essence to water. Just diluted. The water is supposed to have a memory, and thus the law of proving. This method used in determining which medicines were suitable for a specific disease was called proving. To prove remedy, a group of healthy people were given a dose of the substance daily and each person was carefully recorded by the symptom. Such first recorded methods used for determining which remedies were suitable for which disease was acha. To prove remedy, a group of healthy people were given a dose of daily and each person was recorded. Now dynamization or dilution recognize the use of substances that causes symptoms similar to that of the existing was acutely aggregate the condition and the present other side effects. Thus, he advocated the dilution of the substance to the point where the symptoms were no longer present. Liquids were diluted with local ethanol, water, or alcohol, whereas insoluble powders or diluted with lactose, sugar, dilutions are preferred in as 10 or 100 fold steps dilution. 1:10 are designated by US. The dilution combined with succession to increase the actions of homeopathy generally agree that the amount of active substance present vital force life depends on the importance of vital force which runs through the body. Vitalism which if distributed will lead to illness or disease. Homeopathy medicine restores the vital energy balance and stimulates the body's own healing response. Vital force has the ability to react and adapt to internal and external causes. Okay, I'm having a headache now. Introduction. I did introduction. Bioactive compounds. Uses. I don't know. Traditional medicine. I will be doing it. Okay. And principles of treatment. Okay. Next is systematic exploration of natural sources and characterization. Okay, extraction. No. Characterization by compounds done. Biological activity of phytocompounds. Good manufacturing practices of herbal. Okay, database of phytocompounds. Next is pharmacognosy of natural. We have to do this. I don't know ये क्या है. Surface characteristic dissolution. Solution mechanism of drug action have to do. Dose response, time, plasma, drug concentration,